Fresh from the Mercedes Marathon, we welcome Jacob and Jared this morning. Guys, where'd y'all finish?
Well, I finished
Top
first.
five?
Yeah, I finished first. I was so quick, they did not even see me there.
Well, you were so
Flash
far.
Gordon. I was so far behind they didn't record my time. That's right.
We welcome you guys. It's Help Monday, of course, and a very special month, the month of February. We want to talk about that. And I was thinking, Heart Awareness Month and taking care of our heart and stuff. And, you feel your heart beating and that thing stop, that's a lot of trouble. A lot of times it's death. And that's a serious situation. How are we going to take care of our hearts and talk about the Awareness Month?
Well, I guess we should say everybody has a heart. Should we start with that?
Jared's general start. Everybody has a heart.
Everybody has a heart except for Jacob.
Yeah.
Right. Well,
heart disease is an extremely important topic for us. It's one of the things that probably keeps us busiest as pharmacists, talking about with our patients and treating them with medications. Heart disease kills over 600,000 patients in the United States every year, which equates to 1 out of every 4 deaths. So you can see how important that is.
That's phenomenal.
That's a lot.
Numbers.
That's a lot.
Wow. And you guys see a lot of people with heart conditions and treating them with medication. Has the medications improved to help with our heart situations?
Yeah, they have for sure. And, when we're talking about treating heart disease, primarily what we're doing is treating the things leading up to heart disease. And so, the medications we have now to treat blood pressure and cholesterol, being your primary 2 culprits here, are better than we've had in times past. And there are still developments, even in the pipeline coming down to treat those 2 problems that are our general causes of heart disease.
How many people take blood pressure medicine?
Okay, that's amazing. I don't know the exact statistics on that, but in Alabama, and particularly in the Southeast, when you look at the map of the United States, the Southeast is the worst for the most people with high blood pressure. In Alabama, roughly 1 in 3 adults have high blood pressure, which is an amazing number, somewhere around 33%. What's unfortunate about that is of those people who have high blood pressure, only about 50% of them have their blood pressure under control. We have a long way to go. A lot of factors that go into that. People not taking their medication. Some people don't even know that they have high blood pressure. And so we got a long way to go to make that happen.
So, Jacob, where's a starting point for people to find out if they have high blood pressure?
Honestly, it sounds so simple, but, when you get into the real world, sometimes it's not. The first start is, if you're an adult, have a doctor and have regular screenings, appointments for, the first thing they do when you walk in the doctor's office is take your blood pressure. Well, after you wait a long time and then they call your name. Then they take your blood pressure. That's the first thing they're going to do. They're going to weigh you. They're going to take your blood pressure. That's the first thing that's going to happen. A lot of people just don't go to the doctor. I feel fine. Why am I going to a doctor? So they just don't go. And, there's a reason we call it the silent killer. You don't know what's wrong with you. So it's just the first step is just go to the doctor. Have screenings. There's a lot of places you can go and get your blood pressure checked while you're there. We do it at the store.
Okay.
You can check your own blood pressure. Machines aren't expensive. People just don't think about it. But checking your blood pressure on your own, going to a doctor, getting it screened, those are all easy steps that are the first step to knowing if there's a problem.
Is heart disease more prominent in men and women?
Yeah, it's actually the leading killer of both men and women. So you got something that's extremely popular in both. Men generally get it at a younger age, maybe 5 to 10 years earlier than women. And so the recommendations are for men to start getting their blood pressure and cholesterol checked maybe a little earlier than women, but honestly all of us do need to as adults. I want to be sure to mention this, when we're talking about heart disease, it does encompass a number of things. There are some people who have problems with their valves, some people have problems with their heart not pumping enough, but the main thing we're talking about when we use the term heart disease is something that's called coronary artery disease. And all that means is a buildup of plaque in in the arteries. And what that means is if you have artery that's this big and you have plaque to build up on the inside, it's more difficult for the blood to flow. And when that happens in the heart, there's less blood that gets to the heart. And when that blood supply eventually gets cut off, that's what causes a heart attack. So there are a number of things that can lead to that, which we can talk about in just a minute, but just to make sure we're straight on the terms.
And Jacob, we've made great strides in treating heart disease, and you know, I know people today who had quadruple heart surgeries and stuff like that, and you know, they're so the plus is you catch it early, you're in a whole lot better shape.
That's true. You know, you'd rather not be that person who finds out they have heart disease because they have a heart attack and are fortunate enough to live through it and live through the quadruple bypass that comes after that. And again, that person can recover and feel fine. Our ability to live through a heart attack, maintain your life during the heart attack and the surgery and everything is phenomenal compared to what it used to be. But I don't want to be that guy who wakes up after my quadruple bypass and I had a heart attack and nearly died, but I'll be fine.
Well, how many times have we heard stories, guys, of, man, I'm feeling fine, I'm out in the yard working, and next thing I know, I've been in the hospital 3 days.
Absolutely.
Yeah.
It happens all the time. So, you know, Ben Franklin, an ounce of prevention is worth a pound of cure. You know, I'd much rather let's treat my blood pressure and cholesterol now when I have no symptoms from them than be the guy who wakes up 3 days later in the hospital.
What are the causes of heart disease?
Well, some of it is hereditary, actually.
It's Dad's fault.
Yeah, and so as with anything that's hereditary, there's nothing we can do about that. Some of us have high blood pressure, high cholesterol, that we have a tendency toward just because of the genes that we have. But a lot of it, and this is where we can make a difference, guys, a lot of it is based on our lifestyle. And for the persons who smoke, that puts them at increased risk. It definitely does damage to the blood vessels. And for people who do not get enough exercise, it's recommended that we all get 30 minutes of exercise 5 days a week. Now, if that sounds daunting to you, and it very well might, and you're starting out from zero, don't feel like you got to go straight there. Maybe you can do 10 minutes 3 days a week. And we're not talking about running the Mercedes Marathon. Walk around your block for 10 minutes. Get started with something that you can do and build your way up to that. But anyway, persons who smoke, persons who do not exercise enough, persons who eat an unhealthy diet. And honestly, we live in the state of Alabama.
Yeah.
Almost all of us do. But if we eat foods like chicken livers that are really high in cholesterol, if we eat foods that are full of saturated fat, if we eat foods that are full of sugar and salt, those things can lead to heart disease, and those are lifestyle factors that we can control.
Wow. Almost sound like
He's talking bad about bacon.
He almost sounded like he's preaching here on a Sunday morning. You know?
He's ready.
fired up.
He's ready. Altar call's next.
It is Heart Awareness Month and Heart Health Month, and you know, a number of organizations are having events that are runs and that kind of stuff. But treating heart disease, if you're getting to it early and have a good lifestyle, we didn't talk much about cholesterol. Let's touch on that this morning.
Extremely important. Again, cholesterol. Not a lot of symptoms from having high cholesterol.
We all got cholesterol.
We
right?
all got cholesterol. Okay. Cholesterol can be a good thing. Cholesterol is necessary. We have to have cholesterol. When we have a problem is when our levels get too high. And, you know, there used to be a commercial for a certain drug on the market that actually I thought explained it very well. It said you get cholesterol from 2 places, and I forget the clever way they worded it. You know, but you get it from your food, and you get it from your folks. You know, and so, you know, you inherit certain traits regarding high cholesterol, and you eat certain traits regarding high cholesterol. And so, you know, sometimes you got to treat both of those. I can control what I eat. Can't control what mom and dad did to me, you know, psychologically as well. But, you know, so there's medicines for that. And that's, you know, a lot of people can eat right, exercise, do everything you're supposed to do and still have high cholesterol. Now, that's not an excuse for everybody. Most of us have a good amount of control over it, but there are people who have no control over that to some extent. And so that's why we have medicines out there to help control it. So high cholesterol, the main thing we're looking at, the primary thing we're looking at is that level of what we call bad cholesterol, that LDL. When it starts to get above 100, that's when we start to worry. And with certain other disease states, if you happen to have diabetes or high blood pressure, other forms of heart issues, we really got to keep that number down.
So the combination of possibly those three can really be deadly for us.
Oh yeah, absolutely. So we got the lifestyle factors like we talked about, but then Jacob mentioned them. Your high blood pressure, your high cholesterol, and your diabetes. Those are the things that have to be controlled if you really want to prevent heart disease for sure.
You know, what are some symptoms? What are some signs that we may be heading the wrong direction with any of these? We talked about the high blood pressure, and you mentioned a lot of people in Alabama deal with that, but I don't know so much about high cholesterol and diabetes, but is that very prominent as well?
Well, as far as your hypertension, your high blood pressure, and your high cholesterol go, like Jake said, a lot of times people have those.
Is that one in the same, basically, the high blood pressure and cholesterol, or is it different?
Oh, no, absolutely. Blood pressure is your blood pressure is a function of two things: how fast your heart rate is, and then how much resistance is in the blood vessels in your peripheral arteries. And so if you have blood vessels in your peripheral arteries that have a lot of plaque and built up, just think about it. Your heart has to work harder to get the blood through those things. And then the faster your heart rate goes, the higher your blood pressure is as well. That's totally unrelated to cholesterol. But your higher blood pressure makes your heart work harder. And so over time, that does a significant amount of damage to your heart. High cholesterol is, like we said, the buildup of plaque in those arteries and presents a problem with blood flow, both to major organs in your body, but particularly when it's in the heart. That's when we start talking about people having heart attacks, or when it's in the brain, persons having strokes. And so those are major risk factors there. So the truth is that high blood pressure and high cholesterol are very different, but a lot of our people, particularly in the South, have both.
The numbers are actually pretty much the same where we are. 1 out of 3 people have high blood pressure. 1 out of 3 people have high cholesterol. And unfortunately, a lot of times, that one person in each category is the same person. They travel in packs a lot of times. And so, those 3 diseases travel in packs. If you have
diabetes,
high blood pressure, high cholesterol, and diabetes, I mean, that's not an uncommon thing here for one person to have all 3. And that's when we really got to buckle down and work with you to try to keep you safe.
Is that more common among blacks, whites, older, younger?
Yes. All these things obviously are more common as persons get older, right? Obviously. But as far as being a respecter of gender or race, these things are common in all of them.
Wow. Health Monday, and we're talking about heart health in the month of February. Is there information? Are there websites people can go to find out more? Or can they just come check with you guys?
Oh yeah, I mean, the first option, just come talk to us, because clearly we're the best. But no, the CDC, the Centers for Disease Control, has great information on their websites about disease states and just helps you understand what they are, how they happen, how to treat them, what things to be looking for, what to ask your doctor about. Because sometimes, your doctor has a limited amount of time with you. You have to kind of direct the conversation. If you got something on your mind, hey, I've been worried about this. While we're here, will you check this? So they have things to help you understand what to ask about, what to look for when you talk to your doctor. So the CDC's websites are usually very good. National Institutes of Health have good websites on that as well.
Now, you talked about you can come to Marble City Pharmacy when you're there and get your blood pressure checked. And if you're not, is cholesterol stuff done there? It has to be through a medical facility.
Actually, we can check cholesterol. We have a machine that will check your good and bad cholesterol. It'll also check your blood glucose. Generally speaking, it's not paid for by insurance, but we can talk about that and work out the prices for those. Do I have a minute to say something about medications?
You do.
Okay. This is a staggering statistic, but 25% of new prescriptions for blood pressure medication never get filled. Now, this is going to sound extremely easy, but Medicines don't work if you don't take them.
Wow. Write that down.
That's
Okay,
profound. I mean, that's
Yeah.
profound. You just take that to heart, okay? So many people in the United States, so many people in Alabama have been to the doctor because they have issues. They get their prescription. They never fill it once, or they fill it once and never fill it again. Maybe they don't like the way it makes them feel. Maybe they don't like the cost. Whatever the reason. Don't let those things get in the way of you taking your medication. If it's a problem with the cost, work with us. We'll work with your doctor to get you something that's easier to take. If it's a problem because your medication is 2 or 3 times a day and you can't remember the second or third dose, let us know. We'll work with your doctor. We'll get you something once a day that you can remember. Work with us because you need to take your medication.
Health Monday with Jacob and Jared from Marble City Pharmacy. Get by them, visit with them, and take your medicine correctly. Thank you, guys.
Amen.
All right, guys.
More
Thanks.
Daybreak coming up right after this timeout.